So it's a CDC session on improving testing, treatment, and cure of hepatitis C in the United States. The main issue is that we have curative treatment for hepatitis C, and hepatitis C is now a condition that's killing more people than all the other reportable infectious diseases combined. It brings up the issue of how do we get the cure to all the people that need it? How do we stop this epidemic? And so the CDC is trying to determine that and trying to find out the best way to expand hepatitis C recognition and cure. So it begins with finding people who have hepatitis C infection, testing them, and then what we call linking them into care, which means getting them to the treatments that exist. And that can be very complicated. That's actually the step in the United States where a lot of people fall out, is they can be tested, but then to get them to a place where they can receive care, and then to get the care approved for them, and then to get them actually on treatment is where the major gap exists. Well, we've already learned that the best way to expand testing is to make it sort of automatic, to make it so that people that have risk, either because of the years that they were born or because of the kinds of things that experiences they've had in life, automatically are flagged when they enter into a health system and get a test. So the testing bit, I think, is starting to become clear. Make it automatic, and make it automatic not just to test them for whether they have hepatitis C antibodies, but also to confirm that they have ongoing infection by reflexively, automatically testing their blood for hepatitis C RNA. What we're still missing is ways of finding people who weren't already entering into those care systems. So marginalized populations that might not be moving into care yet, as well as ways of getting the individuals who are identified with infection all the way on to treatment. It sounds simple. You just write them a prescription and they start taking it, but it's not, because some of these individuals have very complex lives, and it makes it very difficult for them to want to deal with an asymptomatic condition that they don't even know they have it until you tell them, and then to go ahead and get them approved for these expensive medications, which are impossible to get in most states unless you have the most severe form of liver disease, cirrhosis. And so those are the challenges that we still have to overcome in order to really have impact on this important public health problem.
The biggest takeaway is how important it is for all the healthcare providers to work together in providing the services. Getting people screened is one thing, but having pharmacists involved, having all the even mental health professionals involved to actually support the entire service being provided and really getting people to treatment.